Have you ever stood up after sitting for hours and noticed your hips felt tight, your lower back ached, or you suddenly had to rush to the bathroom? Most people blame their chair, their posture, or getting older. Those things matter, but there is another group of muscles that often gets overlooked. They sit deep inside your body, quietly supporting you every minute of the day. If these muscles become strained, you might notice bladder problems, pelvic discomfort, constipation, or even pain that seems to have no obvious cause. I'm Ross, and today we're going to talk about how sitting for long periods affects your pelvic floor, what is happening inside your body, and simple steps that help protect these important muscles. If you enjoy clear, practical health information that makes medical topics easy to understand, subscribe to the channel and join us for future videos. Now, let's get started. Many people have never heard of the pelvic floor until a problem develops. The pelvic floor is a group of muscles and connective tissues that stretches like a supportive hammock across the bottom of your pelvis. It supports your bladder, your bowel, and, depending on your sex, your reproductive organs. These muscles do much more than hold organs in place. They help you control urination. They help control bowel movements. They work with your abdominal muscles and your back muscles to stabilize your body whenever you stand, walk, lift something, or even cough. They also play an important role in sexual function. The interesting part is that you almost never think about these muscles because they work automatically. Like your heart or your breathing, they quietly do their job throughout the day, until something changes. One question people often ask in practice is, if sitting feels comfortable, how could it possibly strain muscles? The answer lies in what happens over many hours. Sitting itself is not harmful. The human body is built to sit. The problem begins when sitting becomes your main position for most of the day, without enough movement. Think about a typical workday. You sit during breakfast. You drive to work. You sit at your desk. You sit during meetings. You drive home. Then you relax on the couch before bed. Before you know it, you may have spent 10 or even 12 hours sitting. Your body was designed to move between different positions throughout the day. Movement keeps muscles active. Movement keeps blood flowing. Movement helps muscles relax after they contract. When movement disappears, several small changes begin to happen. First, pressure builds around the pelvis. When you sit, much of your body weight rests on the bones at the bottom of your pelvis. The soft tissues, including the pelvic floor, experience continuous pressure for long periods. Pressure by itself is not usually dangerous. The problem is continuous pressure without regular relief. Second, blood circulation slows. Muscles depend on healthy blood flow to deliver oxygen and nutrients, while removing waste products created during normal activity. When you stay in one position for hours, circulation becomes less efficient in those compressed tissues. Over time, muscles become stiff and less flexible. Third, your hips often become tighter. The muscles at the front of your hips shorten while sitting. Meanwhile, muscles in your buttocks often become less active because they are not working as much. These changes affect the entire pelvis. Nothing in the body works completely alone. The pelvic floor is connected to many surrounding muscles. That brings us to one of the most important concepts to understand. Your pelvic floor is part of a team. Above it sits your diaphragm. The diaphragm is your main breathing muscle. Around it are your abdominal muscles. Behind it are your deep back muscles. Together, these muscles form your body's natural support system. Every time you breathe in, your diaphragm moves downward. Your pelvic floor responds by gently stretching. As you breathe out, the pelvic floor returns to its normal position. This happens thousands of times every day. It is a carefully coordinated system. When you spend long periods sitting with rounded shoulders, a slouched back, or poor posture, that coordination becomes less efficient. Your breathing often becomes shallower. Your abdominal muscles become less active. Your hip muscles tighten. Your pelvic floor sometimes ends up working harder to compensate. Researchers continue to study how prolonged inactivity affects this system. Current evidence suggests that long periods of sitting contribute to muscle stiffness, reduced physical conditioning, and changes in posture, all of which place extra demands on the muscles that stabilize the pelvis. Now you might be wondering, how would I know if my pelvic floor is under stress? The signs are not always obvious. Some people notice they need to urinate more often. Others feel like they never completely empty their bladder. Some experience a dull ache or pressure deep inside the pelvis after sitting for several hours. Others notice discomfort in the lower back that improves after walking. Constipation is another issue. Regular movement helps keep the digestive system active. When you remain inactive for long periods, bowel movements often become slower, increasing the need to strain. Repeated straining places additional pressure on the pelvic floor. Some people describe a feeling of heaviness inside the pelvis. Others notice discomfort during exercise or after standing for long periods. It is important to remember that these symptoms have many possible causes. Urinary tract infections, enlarged prostate in men, overactive bladder, pelvic organ prolapse, nerve problems, and other medical conditions produce similar symptoms. That is why symptoms alone never provide a diagnosis. Another area people often overlook is sitting posture. Many of us slide forward in our chairs without realizing it. Our lower back rounds. Our shoulders roll forward. Our head moves closer to the computer screen. This posture changes how pressure travels through the spine and pelvis. Over several hours, some muscles stay shortened while others become overstretched. Neither situation is ideal. A better sitting position keeps both feet flat on the floor. Your knees stay close to hip level. Your lower back maintains its natural curve. Your shoulders remain relaxed instead of rounded. Even with excellent posture, though, your body still needs movement. There is no perfect sitting position that replaces getting up regularly. Some people face a higher risk than others. Office workers often spend most of their workday seated. Professional drivers remain seated for many hours with few opportunities to move. Remote workers sometimes forget to take breaks because home and work blend together. Gamers may stay seated for long sessions. Older adults naturally lose muscle strength with age, including muscles in the pelvic floor. People living with obesity often experience greater pressure within the abdomen, which increases the workload placed on the pelvic floor. Chronic constipation creates repeated straining, which places additional stress on these muscles. Pregnancy and childbirth also change the pelvic floor, making proper recovery especially important afterward. If someone develops ongoing pelvic symptoms, what happens next? Doctors begin with questions. When did the symptoms start? How often do they occur? What makes them better? What makes them worse? They review bladder habits, bowel habits, current medications, previous surgeries, medical history. Sometimes a physical examination provides important information about muscle strength, tenderness, or areas of tightness. Not everyone needs imaging or specialized testing. Those decisions depend on the symptoms and the examination. For many people, referral to a pelvic floor physical therapist becomes an important part of treatment. These specialists assess how the muscles work. Interestingly, pelvic floor muscles are not always weak. Sometimes they are too tight. A muscle that stays constantly tense does not function normally either. That is why doing exercises without proper evaluation is not always the best approach. One common example is Kegel exercises. Many people have heard that everyone should perform them. That is not true. Kegel exercises strengthen the pelvic floor by repeatedly tightening and relaxing these muscles. They help some people. But if your muscles are already overly tight or painful, strengthening them first might make symptoms worse. The right treatment depends on the underlying problem. So, what steps help protect your pelvic floor if you spend most of your day sitting? The first is surprisingly simple. Stand up regularly. Many experts recommend getting out of your chair every 30 to 60 minutes. You do not need a long workout. Walk around your office. Stretch your legs. Fill your water bottle. Take the stairs. Even a few minutes of movement helps restore circulation and reduces continuous pressure on the pelvis. Second, stay physically active outside working hours. Walking, swimming, cycling, and resistance training all improve overall muscle health. Regular activity also helps maintain a healthy body weight, which reduces pressure on the pelvic floor. Third, pay attention to your posture. Keep your screen at eye level. Support your lower back if needed. Avoid remaining in exactly the same position for several hours. Fourth, avoid unnecessary straining during bowel movements. Eating enough fiber, drinking enough water, and staying active all help support healthy digestion. Finally, seek professional advice if symptoms continue. Persistent pelvic discomfort deserves proper evaluation. Ignoring symptoms rarely makes the underlying cause disappear. Before we finish, let's clear up a few common myths. The first myth is that sitting auto damages your pelvic floor. That is not accurate. The issue is prolonged sitting combined with too little movement over weeks, months, and years. The second myth is that pelvic floor problems only affect older adults. People of many ages develop pelvic floor dysfunction depending on their health, lifestyle, and medical history. The third myth is that every bladder problem comes from weak muscles. Bladder symptoms have many possible causes, including infections, nerve disorders, enlarged prostate in men, medications, and other medical conditions. Proper evaluation matters. There are also situations where you should not wait. Seek medical attention if you notice blood in your urine, severe pelvic pain, sudden difficulty passing urine, loss of bladder or bowel control, a noticeable bulge in the pelvis, or symptoms that continue despite lifestyle changes. Early evaluation often leads to more effective treatment. The good news is that your pelvic floor responds well to healthy daily habits. Regular movement, better posture, physical activity, good bowel habits, maintaining a healthy weight. These simple steps support not only your pelvic floor but your overall health as well. If today's discussion helped you understand why sitting all day affects more than your back, I hope you'll begin paying attention to the small habits that make a big difference. Over time, this video is for educational purposes only and does not replace a consultation with a qualified doctor. Thank you for watching. If you found this video helpful, subscribe to the channel for more clear, practical, and evidence-based health guidance. I'll see you in the next video.